Welcome, everyone. I'm Karen Jones, Executive Director of the Waha Warriors. And today we have Dane Christiansen and Josh Fein of Health and Medicine Council with their 2026 August Advocacy Update. Take it away.
Thank you, Karen. A couple of things I want to mention right out of the gate. My name is Dane Christiansen. I'm managing partner at the Health and Medicine Council. I'm joined by my colleague Joshua Fein, who is one of the registered lobbyists for the Waha Warriors. The Health and Medicine Council has been around since about 1980, primarily work with patient organizations that are interested in advancing medical research, developing treatments, and then, of course, also handling coverage and access issues, out-of-pocket cost items on the back end or physician care and issues seeing your doctor. We work with a number of communities. We're very grateful for the partnership with the Waha Warriors to help build that research portfolio, develop those treatments, and address those patient care issues. One thing we will always stress through this process is that Congress has a very big role to play here. But your members, your senators and representatives, don't want to hear from Josh, Karen, or I. They want to hear from you. They know you have a pure self-interest. They're interested in your story. Your voice counts. And I don't want anyone to ever discount that. You have two opportunities to make your voice heard this year. One is advocating with the Waha Warriors, and we're going to talk about some of the specific opportunities and progress we've been making. And the other, of course, is in November when you can vote. But your senators and representatives, regardless of political affiliation or ideology, are there to work for you. They're interested in what you have to say, and they work on your behalf. They can make healthcare decisions, and of course, they're making plenty of them right now. They can do that with your input or without. Much better that they do it with your input, and they know that you have a pure self-interest. This might not come as a surprise, but not everybody is completely truthful on Capitol Hill, and many different stakeholders can tell their story too. So when you go into an office or you do a virtual meeting, they want to know point blank, how is the healthcare system working for you? What's going on with progress? What's going on with seeing your doctor? What's going on with your out-of-pocket costs? You can give them that direct information that they need to make correct healthcare decisions. We are just here to help, assist you, and show you some of these opportunities. We're going to talk a little bit about progress and then upcoming activities today. We're going to start at the 30,000 foot level, what's happening in Washington in general. Then we're going to go into our specific priorities, and then we'll talk about advocacy and making our voice heard. Next slide. So what's going on? Right now, we're in the second session of the 119th Congress. Congress is working to finish the spending bills. The spending bills are important for a couple of reasons. This is the appropriations process. Congress is deciding how much money goes to medical research in the National Institutes of Health, how much money goes to public health and the CDC, how much money goes to building battleships and the military. They are deciding all of these issues. They rely on your input to help make these decisions and prioritize certain things. The other thing that's happening is that Congress doesn't use regular order very much anymore. So if you think about Schoolhouse Rock, a bill passes the House, a bill passes the Senate, gets signed by the president. That's pretty much how the system works. They pass a lot of bills a year. You might see a bill like the Help Copays Act, that's HR 8000. That means it was the 8,000th bill introduced. Well, a lot of those bills just don't move forward on their own. They don't come to the floor, they don't get voted on. And part of that is because there's these slim majorities. There's a very narrow majority in the House, and there's a very narrow majority in the Senate. So any one or two people, if they say, I don't want to vote for this, can disrupt the entire process. But this has had systemic implications. Even bills like prior authorization reform or safe or step therapy with hundreds of co-sponsors don't move forward because they simply lack that bipartisan ability to move legislation. So what happens is they put big packages together and they say, take it or leave it. And usually this is the spending bill. So you have to pass a spending bill to keep the government open and operating. They have these bills and then they take everything else they need to get done and they put it in one package and they say, vote yes or no, take it or leave it. And of course, we have opportunities to make progress, even if that's the current dynamic. In this environment, the administration also has a number of policy changes that they propose. I want to point out, though, that the system still works as the founding fathers intended, and as you probably learned about it in history or civics class. There are three branches of government: the White House, the executive branch, the Congress, your senators and representatives, and the courts. Essentially, the White House and the administration have what's called the bully pulpit, as referred to by Teddy Roosevelt. They can prioritize things. They have a very loud podium. They can say what they want to do. They can say things like, we are going to end the Department of Education. None of that actually happens, though, unless Congress passes a law or does other types of policy making. So your senators and representatives have final say. And I don't know if this is a shock to anybody, but the Department of Education has not ended or ceased its operations. In fact, the last time around when they did funding for the Department of Education, it's funded about $75 billion. I think the funding ended up at 72 billion. So a very, minor cut is a far cry from eliminating. But the important thing there is that it's your senators and representatives that have final say. How much money for research, what policy changes get implemented. The administration has the ability to talk and set priorities, but ultimately, when your senators and representatives are deciding what they should do, they are looking to you for guidance. They work for you, after all. Next slide, please. So, what has this meant for our priorities and the appropriations process? Congress finalized fiscal year 2026 appropriations earlier this year. We would have been advocating for, of course, more money for the NIH, more money for the CDC, and specific new activities through the Rare Blood Disorders Program. Congress provided this funding, but did not provide any additional money. So they included, once again, language saying we really need a better rare blood disorders program that includes conditions like ours. But it's what's called an unfunded mandate right now. They did not provide the additional money. So NIH and medical research got a little bit of a plus up. They dealt with some other bills, but they didn't increase public health funding, even though they did say they agreed with us in starting new programs that we think they need to start. The Congress is doing the fiscal year 2027 appropriations process now. The House has marked up all 12 of their bills. The House has a partisan process. Whoever is in charge writes the bills. The Senate has a bipartisan process. The Senate has not yet done their bills, so the Senate is still working on those, and they have until October 1st. So the Senate is about to adjourn for the August recess, and they're going to come back September 14th. So they're going to have their work cut out for them. But it also means we have an opportunity to advocate with the Senate for our priorities, including the DoD research program, which I'll get into, including the CDC funding, and including building our research portfolio at NIH. The House had said they were seeking to set a floor for spending. The House and Senate do their own bills, then they combine them. The House's floor is $100 million increase for NIH, so better than a cut, but not a lot of money. More money for the DoD research program, more money for the VA research program, but cuts again for public health, which would make it hard to implement some of our activities. So we will get into all of that in a moment. Congress, first and foremost, is going to also pass what's called a continuing resolution to keep the government open and operating past October 1st. And one of the reasons they're going to do this is it's an election year. So they want to be out campaigning. They want to hit the campaign trail, and they're going to do almost all of their work and legislating after the November election. So they'll come back for the lame duck session, and that's when their work will get done. But that just gives us more time to connect with them, to educate them, to raise awareness, and to ask them for their support on our priorities before they finalize a lot of these decisions. Next slide, please. So what were the final outcomes for fiscal year 2026 appropriations? And I think this is an important dichotomy between something like what the White House may want and what Congress delivers. So the White House had asked Congress for a 41.2% cut for medical research in the NIH. Congress responded instead by providing a $412 million increase. Those numbers are not a coincidence. No cut of 41.2%, but an increase of $412 million instead. This is because members heard from their constituents that medical research is important and we need to do more. We were, of course, asking for a few $billion increase, but $400 million, still better than a cut or anything else. There was also this request to create MAHA and start this new public health agency. Congress didn't do that. They said, we prefer business as usual. We prefer the status quo. We're going to kind of keep everything as is. So they didn't increase any funding, which made it hard to deal with a couple of our priorities, but they didn't cut anything or consolidate anything either. And like I said before, they restored all the money for the DoD research program, which is good if we're trying to be included. They're not working with half the money anymore. They've got all of it back, $1.5 billion. And they provided a modest increase for VA research. They also pushed back on things the administration was doing. Congress said we're not changing something called indirect costs for medical research. This was plaguing a lot of academic health centers. It's the amount of money they're allowed to use for like janitorial services to buy lab equipment. The administration wanted to set some artificially low number. The Congress said, nope, we're going to keep everything as it is. And they're also going to restrict something called multi-year funding, which would depress the amount of grants available for investigators, lower what's called pay lines when you're competing to get grants funded. And of course, this would disproportionately impact the rare disease community. So by putting guardrails on that, our researchers would continue to have access to more funding. Congress also said they're very concerned over leadership vacancies at the NIH, and Congress said they want to know anytime a grant is going to be canceled moving forward, because of course they have oversight of these agencies. So very much exerting themselves. They did also make policy changes that were important to the community. They passed Medicare physician reimbursement fix, so doctor pay is okay in the Medicare program. They enacted a 2-year extension of telehealth. This started during COVID, but now you can continue to see your doctor using telehealth. They enacted a bill called the Kids Access to Care Act that lets folks in the Medicaid and CHIP programs see doctors across state lines. If you live in Kentucky, it might be easier to go to Indiana to see a specialist. They fixed that issue. And they enacted a rare disease bill called the Give Kids a Chance Act. Next slide, please. So what are we doing for FY 2027? As I mentioned, the House has set the tone. They've already adjourned for the year. The Senate continues working. The House has proposed a $100 million increase for NIH. They have proposed cuts once again to public health programs, the CDC and HRSA. And they've also proposed increases to other research programs, mainly the VA and the DoD. They've also continued to push back on the administration meddling in research and academic health centers and researchers. They continued to maintain the policy on indirect costs and multi-year funding and say you got to get more money out the door faster. The House includes a lot of what they call report language supporting rare disease research. And I mentioned before, they put bills in there, like the Kids Access to Care Act and the Give Kids a Chance Act. This time, the House bill has language about prior authorization reform, step therapy, and copay accumulators, potentially setting the table to include bills like the Help Copays Act or the Safe Step Act at the end of the year in a big funding package. But all things moving in a good direction. Next slide, please. We have not yet seen what the Senate is going to do. The Senate is still working on their bipartisan bills, and we know the Senate tends to be more generous. They're not going to provide $100 million for NIH. They might provide $1 billion. So that's where we're going to be focusing some of our efforts when we talk about advocacy later on. But what has the administration been trying to do on policymaking? They have announced a rule to say they're going to disrupt how all grants and federal funding are doled out. Instead of this being a scientific process, it would become a political process where political appointees decide what gets funded. This is a problem if there's a political appointee that has a family connection to Parkinson's, perhaps. Nothing against that community, but saying we're going to just dump as much money as we can here undermines a lot of science and research and precedent and many other conditions that also need funding. So this is a very destructive proposal. It applies to all money. So your state government, geologists, but the public health community has been pushing back, and 500,000 comments were submitted saying this is a terrible idea. So the community rallied. They showed that this is bad politics. And more importantly, Susan Collins, who is the chairwoman of the Appropriations Committee in the Senate, sent a letter to OMB saying, please withdraw this rule, basically saying, if you don't deal with this, we're going to. And sure enough, when the continuing resolution was just announced by the Senate, the draft to keep the government open, they have language in there blocking this, saying this will never become law. And that's, of course, because they know academic health centers and patient advocates care a great deal about these issues. So Congress has continued to be proactive in stopping some of these harmful proposals. The NIH is also looking at how they can reform grants and their grant-making process. But then there's some patient care things too. There is an ongoing conversation about essential health benefits. These are protections that exist in the private insurance market and the healthcare program. There's discussions about rolling them back or making them less robust. We would, of course, be against that, but it's all kind of formative right now. And then, of course, we passed this one big, beautiful bill act, which changed Medicaid and made Medicaid more narrow and harder to access. There's a bunch of work coming now on the policy and legal front about defining something called medical frailty. It used to be that if you had a diagnosis like stage 4 cancer, it was automatically assumed that you couldn't work and you could use Medicaid. Now, the new criteria say, well, just because you have stage 4 cancer, that doesn't mean you're not eligible to work. You should be working anyway. So now they're trying to figure out how to do this and also maintain privacy under HIPAA. People don't have a right to know what your everything going on with your health. So this will be an ongoing discussion, but once again, one that we want to make sure continues to be patient-centered and what's best for patients. Next slide, please. And at this point, I'm going to hand it over to my colleague Josh, who's going to talk about our where we specifically fit in to making sure the CDC is getting funding and working for us, making sure the NIH is getting funding and working for us, potentially even doing some type of state of the science conference, next year. And then also that the DoD research program includes us. And Josh's going to talk about how we can do that, what's important, and then also how we can take action this summer and then moving into the fall. Thank you.
Oh, great. Thank you, Dane. Yeah, now that Dane gave you a nice kind of recap of just the 30,000 foot level, what's going on in DC, what Congress is working on. Now I'm going to talk a little bit about just some of our specific legislative priorities that we're going to be advocating for, and also some opportunities to advocate, in the summer, and the fall. So first, the community has been trying to add a condition, acquired hemolytic anemias, to the DoD research program called the PRMRP. What this program is it's part of the larger Department of Defense research program, the CDMRP. And every year, Congress, but specifically the Senate, releases a list of conditions, usually around 40 to 50 of them are included, that are eligible through this program called the Peer-Reviewed Medical Research Program. That program is currently funded at around 370 million, and with around 50 conditions, it's a very competitive program. Getting included doesn't necessarily mean that you're guaranteed any funding. But it is required for you to be on this list that the Senate comes up with every single year to even be eligible for funding. So if our researchers had, the best grant application, great science, if you're not on this list that Congress decides every single year, it simply doesn't matter as you're not eligible, and the DoD will only consider conditions that are on that specific list. So we're asking for acquired hemolytic anemias to be on the list for fiscal year 2027. Normally, by now, we would have already seen a draft copy of the list during the Senate's markup of the defense bill. But because that process has been a little stalled, we have more time to advocate on that, as most likely we'll see that list sometime in September or later in the fall. Other medical research that we support is, of course, the NIH, the leading biomedical research agency, in the U.S. We saw a $400 million increase last year, but the community wants at least 51.3 billion. This is aligned with the larger patient advocacy community, and this would be around an 8% increase, and simply give more money for the key institutes at NIH, the National Heart, Lung, and Blood Institute, and NCATS, which houses the rare disease portfolio of the National Center for Advancing Translational Sciences. More money for those institutes, to potentially have more funding going out to WAHA researchers around the country. And we also support ARPA-H, the Advanced Research Projects Agency for Health, which is a relatively newer agency, that specifically does higher risk and potentially transformative research. Their current budget's around 1.5 billion, and we're asking for a $500 million increase, which aligns with a letter that members of Congress sent to the Appropriations Committee, for FY27. Now, some of the public health opportunities for the community. The CDC's budget right now is around 9 billion. So we're asking for over 11.5 billion, which aligns with the community efforts. But there's specifically a couple of programs, where there are opportunities to really do work in WAHA specifically. One is called the Chronic Disease Education and Awareness Program. This is a relatively new and emerging program at CDC that's specifically designed for conditions like WAHA that don't have any current funding, in terms of line items, at the CDC. And so far, this program has been successful with allowing for over 15 other chronic disease communities to get grant funding of around $300,000 a year to do education awareness activities, public health campaigns across the country. So right now it's at 4.5 million, but we're looking for 6.5 million for FY27. The Senate has previously supported, an increase for the program. The House has as well. Unfortunately, it hasn't come to fruition in the final bills. But we're hopeful that for this year, we'll see that increase. And then Waha could potentially get, some of the money from, newer pending projects, with additional funds that they would get. Another key program at the CDC is within the Public Health Approach to Blood Disorders program. This is the program at CDC that does work on all blood disorders, but rare blood disorders as well. As Dane mentioned, we've had language in the appropriations bill specifically calling out WAHA and the need to do more in this area with WAHA and other rare blood disorders. But the problem is that this program has been level funded by Congress, for many years now at around $10.5 million. So we're looking for a couple $1 million increase, for this program, because CDC simply needs the additional funds to start up, new activities for WAHA and other rare blood disorders. And lastly, there is one bill that's really important to the community. It's called the Clinical Trial Modernization Act. It's introduced in the House by Congressman Raul Ruiz, who's a physician. But this bill would, make it a lot easier for patients to get access to clinical trials and would fix a problem with the anti-kickback statute where companies, can't assist patients with other costs of being a part of a clinical trial, like travel, hotel, these kinds of things, because of the anti-kickback statute. So it would allow for around $2,000 of money to be used, for patients, so that they're able, to participate in clinical trials and make clinical trials more representative of all communities. So, what are some of the advocacy opportunities that we have coming up and that you can be a part of? So, the most immediate one is that in August, we're sending out an action alert to the community, specifically focused on Senate advocacy. So, as mentioned before, the House has moved forward with their process, completing all 12 of their bills, but the Senate hasn't marked up their bills yet. So, we haven't seen what the funding level is proposed for NIH, for CDC, and we haven't seen what the Department of Defense peer-reviewed medical research program eligible conditions list looks like. So we're going to be sending out an action alert soon to everyone where you can write a letter to your senator, specifically asking for three things. One, supporting the funding for the CDC program, the CDEA, supporting additional funding for the Rare Blood Disorders program at CDC, and then supporting the inclusion of acquired hemolytic anemias in the DoD peer review medical research program. As part of this action alert, you'll also have a part where you can share your story, include your personal journey to diagnosis, what it's like living with WAHA, and any other local details that you might want to share as well. And then lastly, in the fall, in September, we have a couple of advocacy opportunities coming up. We do have two options for attending congressional meetings with your legislators. One is going to be in person on September 17th, in Washington, D.C., to, come to D.C., to go to Capitol Hill, meet with your members of Congress, with your senators, the congressional offices that represent you. But then the following week of September 21st, we're also going to have opportunities to do the same meetings, but virtually. So this is via Zoom. We know that travel can be difficult and a little expensive. So that's why we like to have both opportunities. So if you can't make it in person, please be on the lookout for registration info for participating in those virtual discussions in the following week. And specifically, they'll be posted on the WAHA website, but also the Facebook group as well. And with that, we just want to thank all of you for being great advocates for the community and hope to see you as part of our advocacy activities moving forward. And I'll hand it over to Dane and Karen if they have any closing remarks.
Thank you, Josh. Just say we appreciate everybody's advocacy. We've already made a lot of progress with potential inclusion in the Chronic Disease Education Awareness Program with an active pending proposal, potential expansion through the Rare Blood Disorders Program. and potential inclusion in the DoD research program, not to mention expanding research activities at NIH, but your voice matters. It's why this language is included. We know it's been a difficult funding year, but now we need to secure the money that's going to let them do some of these new activities. And Karen, I'll pick it over to you.
Thanks so much, Dane and Josh. The information you provide us is just so valuable. Like they said, check the Facebook page, our private Facebook page, for more information on Warriors on the Hill 2026. Thanks, everyone.